My name is Kelly Mullin and this is Julie Edwards, and our project for community health is the role of the hospice nurse.
A hospice nurse cares for patients at the end of their lives, and it can be one of the most meaningful journeys for the patient, nurse, and family. The hospice nurse's main responsibility is to help people live as comfortably and independently as possible, and with the least amount of pain in their last days. Hospice nurses play a big part in helping patients and their families feel more comfortable about death and providing them with emotional support that they need. A hospice nurse serves as the patient's advocate and case manager. Their job is to monitor vital signs and manage pain and other medications. Sometimes this means that helping families with household chores so they can take care of their loved one. And it may even mean running to the store for a food craving. The hospice nurse also works long hours, including nights and weekends. End-of-life care is important to teach to clinicians and students. The silver hour is one method of illustrating the urgent, intense comfort needs required by patients and families throughout the dying process, wherever the patient may be receiving services. When death is imminent, it is extremely important to provide patient and family-centered care as the waning moments of life transition to the first moments of death. A variety of instructional methods can be used to teach students and clinicians to provide multidimensional, patient-centered care at the end of life. The silver hour marks the last moments of a patient's life and the first moments of death. The events leading to the moment of death vary widely. Fetal demise, sudden cardiac death in the home, heart failure in the long-term care facility, and end-stage cancer at home are different pathologically. Yet persons experiencing these events share many common attributes. The patients who are more than their cause of death have both integrated relationships with the people who love them, and also a need for coordinated, evidence-based, patient-centered care.
The preparation and training for the hospice nurse. Hospice nurses are registered nurses, just as Julie and I are. We were both trained in an associate degree program and are now pursuing our bachelor's degree, and many hospice nurses do the same. They are also able to get specialized certification in their field as certified hospice nurses. The hospice nurse must be capable of compassionate communication with the patients and the families, as this is a very delicate subject at a very delicate time. They need a keen eye, high ethical standards, and knowledge of when to alert physicians and others about changes in the patient, as they can happen very rapidly. They should have emotional and physical stability to deal with the challenges that are presented with end-of-life care. The hospice nurse collaboration. Julie and I find that on our unit at Baptist Nassau that we collaborate on a daily basis with the Warner Center, a hospice facility which is attached to Baptist Nassau. Collaboration with the physicians, other nurses, our social workers, and our chaplains is key to success in establishing end-of-life care for our patients. The team blends the strengths together, and we anticipate the needs of the patient and the family with regard to terminal illness. Again, the hospice and palliative nurses also, we distinguish ourselves from our colleagues in other nursing specialty practices by our unwavering focus on the end-of-life care. Whereas Julie and I do not take care of children or pediatrics, however, we take care of mainly adults, young adults, and elderly adults, and send quite a few of our patients over to the Warner Center for their end-of-life care. It is a 24-hour nursing facility. Nurses traditionally work 12-hour shifts. They manage pain, symptoms, and they provide essential family support during that time. Pain management expertise is probably the essential ingredient to being a successful hospice nurse. Compassionate listening skills, counseling skills promote the highest quality of care for these patients at this time. Hospice nurses must possess a distinct knowledge in the pain and symptom management, as well as knowing the end-stage disease process, the spiritual and both the culturally sensitive care of our patients and families. Loss and grief is important, as well as collaborating with our physicians, being an advocate for the patient during their end of life, handling the bereavement care, and also taking into consideration the many ethical and legal considerations. Reflection. When looking back on choosing the role of the hospice nurse, one thing that we found interesting was not only the continuing legal and ethical debate of the role that hospice nurses may play in the future in participation in assisted dying. Not only this topic came to light when the young lady chose to end her life with a terminal illness that was covered much in the media. We, however, looked at that, and the role of the hospice nurse comes into play as many states may begin to adopt the same laws with which they did, I believe it was in Oregon. And hospice nurses would need to be both legally prepared and ethically prepared to handle this situation should it become legal in their state. It's had growing public interest, the media attention regarding this, for the patient to be able to make a decision to end their life when they so choose, when given a terminal diagnosis. I believe that that will be an ongoing subject for discussion, and also change possibly the role of the hospice nurse in the future. Thank you.